Hi, thank you very much for visiting our website or our YouTube channel or even Facebook. We'd like to explain to you today about understanding how Medicare Advantage plans work. And for our lesson plan, we're going to go by the official federal government 30-page brochure on that. I'm Steve Shorr. I've been in the business like 40 years. And I'll show you my bio and credentials. So on my website, I have a biography page. I graduated San Diego State a long time ago with a major in insurance. I also have a chartered property and casualty underwriter designation. That takes like 5 years to get. At the time, it was all essay exams. As a teenager, I earned the Eagle Scout Award. I'm just going to let my phone ring and go into voicemail. And aside from that, it's a spam phone call anyway. So, and if you do call me, I will return calls promptly. Email's the best way to reach me. And you can see right here, you can email us. And at the top of every page, there's also a contact section. So anyways, I'm a Underwriter Training Council Fellow, Registered Employee Benefit Counselor, Registered Health Underwriter. My state of California license is current. And we do have a link so you can verify our continuing education. For Medicare Advantage, we're required to spend like 10 hours every year doing AHIP certification. Personally, I find it boring because it's the same thing over and over. And one of the things that I don't like is they give us all of these slides and PowerPoints that we're not allowed to show you. So in this presentation, I'm going to show you something I think's very informative. The government published it for consumers. So there's not an issue of showing you what I learned because the government has it, in certain ways. Personally, I don't see any reason for there to be secret agent stuff. It all winds up in court or medical necessity, anyway. So going back to our contact page, you can access this from any page on our website. Here's our business card. You can send us an email, various different ways. And if you want a private meeting, our times are shown. And we only do California, but if you're out on vacation or something, this will show you the time in your area. And if you are asking about Medicare Advantage, we'll send you a scope of appointment because the federal government requires that you give permission for us to talk to you about Medicare Advantage. This video should be okay because we're not going to talk about specific plans, benefits, or prices. I'm just showing you the government brochure that you can get online anytime on either my website, right below us on the YouTube channel, or you can find it on Medicare's website. So let me close this window, the biography window, because we won't be using those further. So Understanding Medicare Advantage Plans. So this 32-page booklet, we're only going to do maybe 20 pages. Here's the lesson plan. So I really like that they've got a table of contents. So you can just simply find what you need and you don't have to read all 32 pages. If you don't have kidney disease, you don't really need to look at that page. And, where can you get more information? Well, just contact us. So anyways, here's their introduction. The two main ways to get Medicare is either directly with Medicare, and it's all Medicare. A is hospital, B is doctor visits, and that you get right from the federal government. There's a separate webpage that I have that explains how to go to the government website and sign up. So then you can do, well, there's really like three ways. You can do just Medicare A and B and not get any other coverage. You can do A and B and get a Medigap plan. You can also get Part D prescriptions. Then they have Medicare Advantage, which is what this video and this booklet is about, where A, B, and usually D are bundled together, and then they throw in a few freebies, and that's Medicare Advantage. Most of the plans in Southern California have no premium. You'll have to check each specific plan. The differences between the two: original Medicare, you need to get a separate Part D prescriptions. Medicare Advantage usually has that. Medicare leaves you with deductibles in the hospital, skilled nursing, 20% coinsurance. A Medicare Advantage plan has a schedule of what your copays are, so you just have to compare them. But really the main difference is on a with straight Medicare or Medicare and a Medigap plan, you can use any doctor or hospital anywhere in the United States. You just go in and see them. If you get a Medicare Advantage plan, you have to check that the doctor's in that plan's network. So either way, you have to get A and B from the federal government. Medicare Advantage, they'll probably include Part D. Medicare A and B, you can add Part D, and you can also get a Medigap plan. And I have a separate video, and there's a separate federal brochure on that, and there's separate pages on my website about that. And then it goes into, some more details. Original Medicare and Medigap, you can use any doctor or hospital. Got to use a plan network on Medicare Advantage. You generally need referrals to see a specialist. Original Medicare and Medigap, you usually pay 20% of the Medicare approved amount. So you're going to see, like, sometimes you might see a bill for $20,000 and then Medicare goes through it and you only owe, maybe they only approved $1,000. So then you're paying 20% of $1,000, not $20,000. So personally, I am over 65. And when you get a bill, I don't even pay attention to it until I see that they've adjusted it for what my Medigap plan pays and for what Medicare allows. And then I worry about how much do I have to pay. Personally, I have a high F plan. It's $2,300 deductible, and I did that because the premium savings was there. Insurance companies are here to make a profit, and basically they're required to spend 80 cents in claims on every for every dollar they take in. Now, a Medigap plan, well, I'm not quite to that part. So Part B Medicare, your doctor visits, is going to run you $144 a month, and that's just there. You pay it to Medicare, and it's $144 a month. If you make a lot of money, if you're fortunate, you'll pay more. And there's a separate web page that I have to explain how much more you pay if you're fortunate to make more than, say, $85,000 for a single. Part D will run you $20 to $100 a month. And if you make a lot of money, they surcharge that. And if you make very little money, there's a thing called low income subsidy, which is a whole separate web page that we can go through to explain how to get that. Now, there's few and far between. There are some Medicare Advantage plans that will help you pay part of your Part B premium, but then they may or may not give you, better benefits elsewhere. The coinsurance, the 20% coinsurance on Medicare, there's no limit on it. So that's one reason to get a Medigap policy, or to go into Medicare Advantage where there is a limit and it's all copays. So here it talks about getting a Medigap plan to pay that, and we've got a separate video to go through that. If you get a Medicare Advantage plan, you're not allowed to buy a Medigap plan. Here it says Medicaid. In California, it's Medi-Cal. And, you know, somebody posted a note on Facebook, said we should all get Medicare for all, because then Medicare will just pay every visit that you have if your doctor orders it. No, it doesn't work that way. It never worked that way. No insurance works that way. It's medically necessary. And that is a definition, just says that it's got to be medically necessary. And that's all I can really say right now. There's a separate video on that. Well, yeah, there is a separate video on that. It was done a few years back, but I've got a web page that talks about the clinical bulletins of what the insurance companies feel. I've got another web page on appeals. So if you want to appeal, if they say it's medically necessary or not, you know, you can do that. Medicare Advantage also has to cover medically necessary. And, you know, they have their own systems for appeal. Medigap or original Medicare, you get a separate drug plan. Medicare Advantage, they're usually included. Medigap or straight Medicare, you don't have to get approvals. Medicare Advantage, you usually do. Original Medicare doesn't cover outside the United States. If you get a Medigap plan, those would generally cover up to $50,000 for emergencies for 2 months. So if you're out of country longer than 2 months, then you no longer have that coverage. So we do have travel policies. That's a separate page. So just email me and we can get you all that information if you have trouble finding it on our website. Medicare Advantage doesn't cover outside the United States, although most of the plans that I see do cover emergency care, but here it talks about they don't cover non-emergency care. So, you know, that's something. If you have a question, just email us and we'll get that to you. Okay, then here's some more definitions on what all these things mean. They've defined deductible, co-insurance, and co-payments. So, you know, co-insurance is basically like 20%. Co-payment is, say, $10 to $20, and deductible is what you pay before it pays anything else. Now, I find that probably 9 out of 10 questions that people ask me about, is this covered, is that covered, how does this work, how does that work? I just look at the evidence of coverage, because there they may have a 3-page explanation, and evidences of coverage are mandated to be in plain English. So it works a lot easier to just read that than try to read the law and explanations, because the law isn't necessarily easy to find, and also it's often in legalese, whereas the evidence of coverage is mandated to be in plain English. They've got a table of contents, and I have a separate video on how to read your evidence of coverage. Who can join a Medicare Advantage plan? First, you have to have Part A and Part B. And if you have end-stage renal, there are special plans for that. There are special rules, like if you were already with an insurance company, you can stay with them. But if you have that issue, visit our webpage or email us. It's a complex situation. When can you join a Medicare Advantage plan? The main time is when you turn 65 and during the open enrollment period. Now, they keep changing all these definitions, because open enrollment period is now known as AEP, annual election period. And open enrollment period is a brand new thing. I don't think agents are allowed to tell you about it, but if it comes up, then we can discuss it. But the new term for open enrollment, I've got it on my website. So if you have any problems with any plan, just call me and we'll discuss it. We may need to do a scope of appointment where you write permission for us to discuss it. But this is a little bit out of date because there's now the open enrollment period is something different, and annual election period is what we're talking about between October 15th and December 7th of every year. And you'll see ads all over the place for that. So if you do have a Medicare Advantage plan, you can't get Medigap. It's just, you just really can't do both. And if you do go into a Medicare Advantage plan and then you want to go jump to Medigap, there's special rules, and I won't go into those details. You can look at it here, or I've got it on a separate page where it talks about the times you can get into a Medigap plan, and the federal government has different brochures, and then I've got the ones from specific insurance companies, how they interpret those rules. And that pretty much covers it. This is probably one of the shortest videos I've done. So you'll find our contact information at the bottom of our YouTube page, on our Facebook page. And I've just set it up. I'm not sure if it's working yet, but in the right-hand corner here, it should have our web address, Steve Shorr, SHORR.com. And from there, you can hit our Medicare website. So thanks a lot for watching, and be sure to subscribe to our YouTube channel. If you're watching this on Facebook, give us a like, and you'll see, all our updates. During the shelter at home, I've certainly got plenty of time to do more videos, do more study, make our website, more informative. And so thank you very much for visiting. Bye.